Hi everyone. For this demonstration I'm going to do a female catheterization. I would like if you could view the video male catheterization, because in that video I'll be showing you how to set up your sterile field. So what I've done here is I've already set everything up. I have my catheter lubricated at least 7.5 centimeters. I have my swabs open and ready to go, and I have my syringe attached to my catheter, and I've checked for the bulb for any leakage. I have my patient draped and positioned adequately. So for a female, you'd want them in that lithotomy position. So basically laying on their back with their legs to the sides and knees bent. If they can't do that positioning, you can actually ask somebody to hold a leg for you or use pillows to keep the legs propped up. Once I'm ready to go, I'm going to take my tray and I'm going to take it down to my sterile field. And then I'm going to go ahead and I'm going to clean the labia. So I'm going to just open the labial folds up, and then taking my swabs, I'm going to clean the labial fold the furthest away from me first. Then I'm going to clean the labial fold closest to me second, and so moving front to back. And then I'm going to go down the center. So across the meatus and going down. Once that's complete, I'm going to go ahead and catheterize. So again, I'm going to get my patient to either bear down or take a deep breath and exhale. And once they do that, I'm just going to gently insert. So again, going at least 6 centimeters or until I start to see urine coming out of the end of the catheter. And at that point, I'm going to go ahead and insert a little bit more, so another 2 centimeters. And then once I've done that, I'm going to hold on to the catheter with my non-dominant hand and inflate the bulb. When I'm inflating, I'm always checking my client, so make sure that you aren't inflating it in the urethra, that you've actually inflated in the bladder. So if your client starts to complain of any pain, you need to stop immediately. Once I've inflated the bulb, I'm just going to pull back until I meet resistance, and then I can go ahead and disconnect this and connect my Foley catheter to my sterile drainage bag. I'm going to secure the catheter to the client's thigh, and I'm going to clean up the supplies and give my patient some peri-care. I'm going to also secure the drainage bag to the frame of the bed below the level of the bladder. I'll go back to the nursing station later, and I'm going to document in the nurse's notes why I catheterized, the size of the catheter, the size of the bulb, and my patient's response. I'm also going to chart the quality and quantity of the urine, and I'll do that as well on the intake output sheet. And that concludes female catheterization.